Why would an insurance deny a charge as provider not licensed for this type of service? What does that mean? What are the causes and solutions? Are there tips to know? Welcome, I am the medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So, does your insurance really mean that you cannot get the type of medical services you did? Let's explore 3 major reasons. The first one is a simple coding error. The provider billed an incorrect or unrelated diagnosis. For example, a speech therapy session billed as autism for an autistic child would be denied. Why? Because speech therapists cannot treat autism. They can only use a diagnosis that relates to a speech impairment or developmental delay. Unless you are in a rural area or that there are no other options, chemotherapy is usually never ordered, prescribed, or paid for when rendered by a PCP. An oncologist must be involved. Not pre-authorized ahead of time, chances are those services will be denied as beyond the scope of practice or license. The second major cause are missing credentials on an invoice. I'm referring mostly to out-of-network invoices that you receive. You get some form of a super bill or claim form to submit to your insurance for reimbursement, and that's when that claim is rejected. The explanation of benefit will often refer to lack of credential, meaning either something called an NPI number is missing. It is the National Provider Identifier, which is individually obtained by every medical professional in the US as well as billing entities. Every medical provider in the US must use an NPI for administrative and financial transactions with a health plan. Yes, that includes an invoice given to you even if you have already paid the bill in full. Another reason is oftentimes, or too often, I see invoices with just a name. Is the provider an MD, a PhD, a DO, a PA, a LSW, or a LCSW? If it's not written on the invoice, how will the insurance know? I guarantee there is more than one John Smith out there with a medical license of some type. The third cause is because services were billed to the insurance when they are either not covered or specifically listed as exclusions. What it means is that the provider is not technically recognized as a medical professional. Even if the services have been prescribed or recommended by an actual physician, those services rendered by non-medical professionals without a medical license or without proper credentials are not payable, especially if listed as an exclusion. Services considered alternative or complementary therapy or medicine are not mainstream or standard of care medical treatments and therefore are not covered usually by medical policies. I am thinking of a massage therapist, holistic therapy or energy healer, acupressure therapist, herbalist or trainer. A prescription from your PCP or specialist is not enough. For example, let's take the massage therapy. If rendered by a doctor of physical therapy or occupational therapist, it is usually covered. However, if your regular masseuse gives you that once a week or once a month massage, that is not covered. Considering hypnotherapy, well, If by a hypnotherapist, chances are it's all your cost. But if performed by a psychologist or psychiatrist, it may be reimbursed. Therefore, some denials are justified, and even if you appeal, will not be reimbursed or payable. Are there solutions? Well, yes. The billing provider must correct any diagnosis code and resubmit or give you a corrected invoice. Do not send it back to the insurance as a new claim, but as a corrected claim to avoid a rejection as a duplicate. If credentials have been missing, do ask the billing provider or biller to please add those credentials as well as any NPI that may be missing as well. Same thing, we submit as a correction to avoid a rejection as a duplicate. Last but not least, make sure that your claims are payable rather than wasting your time sending them for processing and reimbursement, getting rejections or denials, filing appeals, or making calls for nothing. If a provider of service does not have a medical or professional license or accreditation, those services are your responsibility. Just think, prescription medications are covered by your plan, right? But not over-the-counter medicine. Same thing applies to other types of services. I only have one piece of advice, one tip today. The best thing for you to do in the third case is to investigate and look through your summary of benefits. Some plans are more generous than others and may cover modalities or services that other plans do not. When in doubt, contact your insurance directly to find out whether or not it is worth your while trying to get reimbursed or having the provider bill your insurance directly for services, and avoid frustration and waste of time and effort. I thank you for watching. Your likes, comments, and subscribes help the channel grow, so thank you.